Fluoride is a neurotoxin, and it's in your water. It's not just in your toothpaste. It's not just in your mouthwash. And Britain is highly fluoridated. Now, the rest of the EU is not. In fact, America, the US, we drink more fluoridated water than all other countries combined. I don't know if that explains what's going on here, but I don't know. Back to that
But I'm
whole.
assuming it does have some benefits for teeth. Otherwise,
It
why would
does.
we
It can remineralize a demineralized tooth surface, enamel surface. It can, but it also causes brain damage. I can fix a tooth. I cannot fix the brain. We really can't. Once the IQ is dropped by 4 to 9 points, which is we have 70, 68 studies that from all over the world that support that concept, that notion. It's not a notion. It's a hypothesis theory. Then, but we have alternatives that can remineralize actually a little bit better in some cases. Fluoride does remineralize topically. Fluoride ingestion as a child, fluoride gets into the bloodstream, it gets into the enamel organ, which is the organ, the tissue, the embryonic tissue that where the tooth forms from inside your jawbone, and then it erupts. And then from that point on, your tooth has a blood supply. It has arteries and veins that go into it. It has a neurological, it has a nervous supply. And then it has that tissue in there that can try and fix the inner surface of the tooth. And that's where we get tooth pain from. It gives you sensation. Most of this sensation from chewing comes from the periodontal ligament, which is that girdle of periodontal ligament of collagen fibers outside of the tooth. But if you were to put a little bit of ice on a tooth or some heat, the tooth would respond because it does have that capability.
And you're saying there that there are alternatives. What should people
Yeah,
be looking for?
hydroxyapatite. I mean, it's first of all, it is the main ingredient in enamel and dentin. Those are the two major structures of the tooth. It's biomimetic. It's found in nature. NASA rediscovered it, and back in the 60s, they were worried about bone density with their astronauts. Don't know if they were concerned about remineralization of the teeth. I don't think they got that far. Some websites talk about that, but I've seen no.
I feel like they had a lot of other things on their plate to deal
Exactly.
with on
Yeah.
those
I mean,
missions.
come on, a cavity in space. No, they get checked, and they were only spending 2 weeks in space. They weren't going to get a cavity, but the bone density in their bones, that was an issue. So they were working on supplements, and hydroxyapatite is used in the medical industry. It's used for by osteo, the bone doctors and implant specialists and coatings, but then the Japanese bought or licensed it, and they've been using it in their toothpaste for at least 40 years now. It has come to America. The irony is that the best form of hydroxyapatite that actually remineralizes teeth the best, and that is in toothpaste. We don't put it in the water. Actually, putting hydroxyapatite in water does not work. It actually makes things a little worse. And then combining fluoride with it also is bad. But when fluoride is in your toothpaste, it has a negative charge. The tooth, the demineralized area has a positive charge. They're attracted to each other. That's if the fluoride can come out of solution in the saliva. And it kind of smooths out that little dent in the tooth where it's lost calcium. Unfortunately, fluoride is more brittle and it's more wavy. And so that outer layer, if it's been remineralized with fluoride, doesn't look as good. It doesn't reflect light in the same way. So by using hydroxyapatite, you can actually whiten your teeth, or it's a perceived lightness or increase in value of the tooth when you see it in light. But the fluoride was used because it was discovered back in the 20s in the U.S. somewhere in a small town outside of Denver in Colorado. There was a lot of fluoride in the water from a well. It was the ambient level of fluoride. And that can happen. Well, there's a lot of fluoride in well water, sometimes too much. And the kids were coming out with little white spots, sometimes brown spots. That's called fluorosis. That's too much fluoride in the teeth. But they seemed to be getting less cavities than the town next door, which didn't have fluoride in the water. And then without doing any science, it jumped into, within 10 years, maybe a little bit longer. I mean, Alcoa got involved, the big food and phosphate fertilizer industries got involved, because guess what? That was one of their main byproducts in producing their product. and this was a great way to get rid of it. And then we said, okay, let's put it in the water, not the well water. Let's put it into the reservoir, or put it into tablet form and have your kids swallow it. And then the science came out, and it's like, oops, okay, it's bad for the brain. It could be bad for bone density. There's an increase in a likelihood of hip fractures. But let's focus on the brain. That's pretty big. A pregnant woman right now in England should be filtering their water. They do not want to ingest fluoride because it will lower the IQ of your child. We have enough data to stand on that fact. And, there are inexpensive tabletop filters that will do that. There are just a few. We have one in America called Clearly Filtered. It's $70. The filter lasts 3 or 4 months, and you can pour any fluoridated water in there, and it'll come out. 99.9% of it will come out. So that is something that needs to be said and needs to be broadcast. This could help generations of children, and it's so important to think that way.